Hello, my name is Jordan. I'm going to be talking about differential diagnosis of tennis elbow. So, what is tennis elbow? It's also referenced as lateral epicondylalgia, lateral elbow tendinopathy, and lateral epicondylitis. It's characterized as pain in the lateral epicondyle of the elbow, typically involving the extensor carpi radialis brevis, usually in the dominant hand. As you can see here, that's the outline of the muscle. Pain can be produced with gripping and squeezing, wrist extension, twisting, and usually resulting in decreased grip strength. So it's very common. About 40% of the population, at least once in their lifetime, experiencing lateral elbow pain. So who's at risk? Typically, females and people with history of smoking were found to have this issue more frequently. It's typically common in manufacturing workers, service workers, and people that use computers regularly. Talking about the computer users, I found a research article that talked about people that use computers 4 to 6 hours a day had a 26% prevalence of having lateral epicondylitis like symptoms. So, what has been our traditional treatments for this issue? So, historically, we've been using eccentric strengthening of the wrist extensors. Um, while the research still supports the benefits of eccentric strengthening, many studies report varied results with some limitations. I found an article. It was a systematic review and meta-analysis that basically concluded that eccentric strengthening for the lateral elbow muscles was superior to the concentric strengthening in terms of the VAS pain scales. But surprisingly, though, the study didn't find any significant improvement in their grip strength in either group for concentric or eccentric. So this is where I kind of come in with a differential diagnosis. So I found some interesting articles here. I found a study that found that 70% of subjects with lateral elbow pain experience pain also in the cervical spine and thoracic spine, in comparison to just 16% in the control group. This study also showed that subjects with lateral elbow pain and cervical and thoracic spine pain had significantly higher positive responses to provocation tests, which included upper limb tension test of the radial nerve, as well as a painful springing test of the thoracic spine, but not assessing for mobility, just essentially with assessing for pain. They also had more limitations in cervical flexion and extension range of motion. I found a really good article here. It was a randomized sample-sized planned, placebo-controlled, patient-blinded trial that found that subjects with lateral epicondylitis that received thoracic costal vertebral T5 mobilization at a frequency of 2 hertz for 2 minutes yielded an average of 9.5 pound increase in their pain-free grip strength in comparison to sham ultrasound treatment. So it's pretty significant improvement just having mobilization of the thoracic spine. So what do we get from this? So, um, could lateral epicondylitis be kind of like an unusual cervical radiculopathy or like kind of like a T4 syndrome? I think from these studies and also how difficult it is to treat lateral epicondylitis, proximal screening for the cervical and thoracic spine is very underutilized. At least in my experience, I don't see very many people screening for this. And, thinking about its relation, think about your dermatomes. Your dermatomes for C6 is right along that lateral epicondyle. The myotomes, so C6 is wrist extensors, C7 wrist flexors, finger extensors, and C8 is finger flexors. So these are all myotomes that can contribute to grip, and that's the thing that's usually impaired for individuals that are suffering from this. And then maybe we need to look at some postural assessments. I don't think it's a coincidence that a lot of these subjects have this pain that are doing office work using a computer. So we might need to look at some ergonomics for them to help them improve on those ideal work conditions. And I think from these studies, I really think we need to utilize cervical and thoracic mobilization in combination of eccentric wrist extensor strengthening. I think if we use both of these things, could it be more of like the proximal issues, or could it be more of distal issues of the elbow? Either one, I think if you address both of these things, I think they would typically yield better outcomes. And ultimately, we just need more research. So, you can't get enough research for lateral epicondylitis, especially how difficult it's been to treat. And these are my sources. Thank you.